In this video, we'll be discussing the effects of breastfeeding on your menstrual cycle and how it can impact your overall health. We'll discuss the different hormonal changes that occur when you are breastfeeding, as well as tips for managing any potential issues. 1. What are the hormonal changes that occur when you are breastfeeding? When breastfeeding, the hormones prolactin and oxytocin are released. Prolactin is essential for milk production, while oxytocin helps with milk ejection and production of breast milk. These hormones also work to suppress estrogen and progesterone levels in the body, which can cause a delay in a woman's menstrual cycle. As long as a woman is breastfeeding regularly, her estrogen and progesterone levels will remain low, and she will not ovulate or get pregnant. 2. Is it normal to have irregular periods while breastfeeding? Yes, it is perfectly normal to have irregular periods while breastfeeding. In fact, it is common for many women to experience anovulatory cycles without ovulation or amenorrhea, absence of menstrual bleeding. This is due to the increased levels of prolactin and oxytocin in a mother's body during lactation. These hormones prevent ovulation from occurring, which can cause the absence of periods or irregularity. For some women, their regular cycle will return shortly after they stop breastfeeding. However, this isn't always the case. Some may take several months before their period returns back to normal, or even longer depending on the individual's hormone balance and health status. It is important to remember that it is normal to have irregular periods while breastfeeding. If you are concerned about your menstrual cycle, speak with your healthcare provider for further advice and guidance. And of course, if you are planning on becoming pregnant again, do not forget to take adequate prenatal care and speak to your doctor before doing so. Proper nutrition is also a key factor in maintaining a healthy menstrual cycle, so make sure to eat a balanced diet full of fresh fruits and vegetables. 3. How can breastfeeding impact your menstrual cycle? Breastfeeding can affect the hormones that control your menstrual cycle. During breastfeeding, your body produces oxytocin and prolactin, which can delay or suspend ovulation and menstruation. This period is known as lactational amenorrhea, absence of periods. When you're exclusively breastfeeding, your body may produce these hormones in larger amounts than normal, preventing ovulation and therefore delaying the return of menstruation after childbirth. Some women experience a lengthened menstrual cycle while they are breastfeeding. This is because breastfeeding can interfere with regular hormone production and release, causing delays in ovulation and menstruation. Other women may find their cycles remain fairly similar to when they were not pregnant or nursing. 4. Can certain medications be taken while breastfeeding? Yes, as long as the medication is safe for breastfeeding mothers. Certain types of oral contraceptives can be safely taken while breastfeeding and are typically recommended to suppress ovulation and postpone a regular menstrual cycle. However, women should always consult with their healthcare provider before taking any medications while breastfeeding. Some medications may not be compatible with breastfeeding or may pass into breast milk, which could cause adverse effects on the baby. It is important to consider all potential risks when deciding whether or not to take medication while nursing. Additionally, some supplements and herbal products that claim to help regulate hormones may also interfere with your body's natural processes, so it is best to avoid them altogether if possible. 5. Are there ways to manage any potential issues related to breastfeeding and your menstrual cycle? Yes. There are several ways to manage any potential issues related to breastfeeding and your menstrual cycle. For example, you can start taking a multivitamin or supplement designed specifically for postpartum women that contain the nutrients needed to support lactation and reproductive health. Additionally, you may want to consider drinking more water throughout the day to reduce stress levels, which could help regulate your hormone levels. You should also make sure that your diet is balanced and includes plenty of fruits and vegetables. 6. Does the length of time you breastfeed affect your menstrual cycle? Yes, the length of time you breastfeed can have an impact on your menstrual cycle. When you first start breastfeeding, This process is called establishing lactation, and during this time, your body will produce hormones to help with milk production. These hormones, known as prolactin and oxytocin, work directly on the hypothalamus and pituitary gland in your brain to inhibit ovulation. This means that if you are exclusively breastfeeding for a long period of time, at least 6 months, it can delay the return of your menstrual cycle due to the suppression of ovulation. This effect is also known as lactational amenorrhea method LAM. 7. What kind of advice should someone consider before starting a family if they are planning on breastfeeding their baby in the future? It's a good idea for those planning to breastfeed their babies in the future to modify their lifestyle now in order to prepare for the changes that will take place during and after breastfeeding. Eating a healthy diet, exercising regularly, and getting enough sleep are all important steps for maintaining overall health before starting a family. Additionally, it is recommended to consult with your healthcare provider prior to pregnancy so they can help ensure you have strategies in place to balance any potential menstrual cycle changes caused by breastfeeding. Lastly, it's essential to stay informed of the latest research on breastfeeding and its effect on menstruation so that you can make an educated decision when deciding which type of feeding method is best for your baby. We've discussed how breastfeeding can affect your menstrual cycle, from changing the timing of when it starts to even potentially skipping periods altogether. We hope this video has been helpful and that you're now better informed about possible changes in your body while nursing a child. If you have any questions or comments regarding what we talked about today, please leave them below. We'd love to hear from you. Thanks for watching, and don't forget to subscribe so you never miss out on our informative videos.